Hi there, my name is Barbara Ann Ganitano, and I will be performing a neurological exam by assessing 12 cranial nerves. Here is my volunteer patient. Her name is Emily, and she's giving consent. So basically, I'm in the patient bay. I've done hand hygiene, and I've performed hand hygiene, and I've provided for privacy. So Emily, tell me your full name and your birthday.
It's Emily McConaughey, and it's 10/12/77.
Awesome. Do you have any allergies?
I do.
Okay.
That's latex.
All right, so we'll make sure there's no latex here. All right. Okay, so we're gonna start by assessing cranial nerve number 1. We're assessing her sense of smell and nerve patency. So, Emily, I am gonna have you just look straight ahead, and I'm gonna shine a light in your face, in your nares, to see if everything is patent. So, I'm assessing her nares. Nares looks patent. Okay, and then Emily, can you occlude one side, blow out, the other side, blow out? Perfect. If I had like coffee grounds or maybe an orange peel, I would ask her to close her eyes and see if she can tell me the scent. So that would conclude my first cranial nerve. Second cranial nerve, we're assessing the visual fields with the Snellen chart. So if I had a Snellen chart, I would have her stand 20 feet away and have her read the first lines or two to be able to see if her vision's 20/20. So for recording purposes, her vision is 20/20. We have assessed her vision with the Snellen chart. So now we're gonna test her eyes and see if everything is within normal limits. Emily, I'm gonna shine the light in your eyes. So, okay, pupils are equal, round, reactive to light and accommodation. There's no drainage, there's no swelling, and there's a positive red reflex. Her optic disc looks creamy, yellow, and there are no abnormal swelling or thickening. Okay, so now we're in cranial nerve 3, 4, and 6. We have the ocular motor, the trochlear, and the abducens. We're gonna inspect her eyelids. Can you close your eyes for me? Perfect. There is no ptosis, eye drooping. And like again, we did assess the reaction to light, and her pupils are equal, reactive to light and accommodation. Now we're going to assess her fields of cardinal gaze. So I'm going to have you look at the top of this for me. And I'm just going to have you follow the top with your eyes. Okay, beautiful. So there is no nystagmus noted or no ptosis. And her eyes are reactive to light. Now we're going to assess cranial nerve 5 and 7, which is the facial nerve and the trigeminal nerve. I am going to have you clench your teeth, smile, frown, stick out your tongue, puff out your cheeks. Okay, so muscle tone on, I'm going to place my hands on your face. Muscle tone is equal, symmetric, and strong at both ends. There's no fasciculations when she clenches down, and everything is within normal limits. There's no muscle or facial atrophy, no tremors noted, and everything looks like it is appropriate to her race and ethnicity as well. Okay, so now after assessing cranial nerves 5 and 7, usually it's a cranial nerve 8 next, which is the acoustic nerve, but I will skip that and go to 9, 10, 11, and 12. So for 12, the hypoglossal, I'm gonna have you stick out your tongue for me, move it side to side, in and out. Sorry, okay, thank you. Now I'm gonna place my hand on your cheek, and you're gonna put your tongue against my hand, okay? All right, so her tongue strength is equal bilaterally, and the strength is pretty symmetric. Can you say la la la,
La la la,
ta ta ta,
ta ta ta,
na na na?
na na na.
Her LTN pronunciations are normal and within what it's supposed to sound like for speech sounds. Next, we're going to assess her cranial nerve number 11. This is a spinal accessory. I'm going to place my hands on your shoulder, and you're going to shrug. Okay, beautiful. Now I'm going to place my hands on her cheek and go against my hand. Okay, the other side. All right, so the strength is equal. There's no abnormalities or deformities or swelling or pain in anywhere. Next is cranial nerve 9 and 10. We have the glossopharyngeal and the vagus nerve. So for that, we're gonna test your gag reflex. So say I had a tongue depressor, I could use that to check for her gag reflex, and that would cause her to gag. But I'm just gonna have her swallow. Okay, and do you have any trouble swallowing or anything like that? She has no dysphagia. No dysphagia noted, and gag reflex is present. Next, we are on cranial nerve number 8, and that's the acoustic nerve. And here we do the whisper, the whine, and the Weber test. I currently don't have the tuning fork, but we'll just work with that. So I'm gonna go behind you. I'm gonna whisper a number, and you're gonna tell me what number I said.
Okay.
Okay, so I'm occluding her right ear.
10.
Okay. Left ear.
20.
So she can hear me equally in both ears. Say I had the tuning fork. We'll pretend this is the tuning fork. I'm gonna bang it. I'm gonna place it behind her mastoid process. She'll tell me if she can hear the ringing or not. Do you hear the ringing?
Yes.
Okay. Same for the other side. Do you hear the ringing?
Yes.
Okay. And if necessary, we can go on the top of the forehead to see if she hears both ringing in the ears. Okay. So that concludes that. And that concludes our cranial nerve exam for the neurological system. Thank you.